So we were asked by the U.S. Preventive Services Task Force to look at whether there was evidence that screening for vitamin D deficiency in persons without known symptoms of vitamin D deficiency or conditions associated with vitamin D deficiency would lead to improved health. We didn't have any screening studies to look at to answer this question. So instead we had to get at the answer to this question more indirectly by looking at treatment studies. So studies that took people that were vitamin D deficient and seeing if giving them vitamin D resulted in improved health outcomes. We did not find any evidence that treating vitamin D deficiency led to a decreased risk of fracture, cancer, diabetes, or improved physical or psychosocial function. We did find evidence that treating vitamin D deficiency led to a reduced mortality in elderly persons who were institutionalized, who were in nursing homes or other places where they had assisted care. We did not find any reduced mortality in community dwelling elderly. And we also found a suggestion of some possible beneficial effects of vitamin D on people who were deficient in terms of their risk of falling. And the strongest evidence there was for the average number of falls. So people that were given vitamin D had a fewer average number of falls per person. We know that vitamin D is really important for bones. And so I think it surprised me a little bit that we didn't find that treatment of those low levels of vitamin D led to improved fracture risk. I think our data is pretty limited, though, in that there weren't a lot of studies, so we may not have had enough people to see an effect if it's a relatively small effect. The biggest challenge we faced was, how do you define vitamin D deficiency? So there's one issue in that there is not currently a gold standard assay or material for determining which vitamin D assay is the best. And so a lot of times if you measure a vitamin D level with one assay and then you use another assay, you could get enough of a difference between the two assays that if someone is close to the cutoff point, they may be labeled deficient with one assay and not deficient with another assay. So we had to really struggle with how to consider that in the evidence review. There is not a universal consensus about what really is the optimal vitamin D level. So while most experts agree that for bone, to make sure bone is healthy, most people should have a vitamin D level greater than 20. Some professional bodies believe it should be actually greater than 30 for your vitamin D level. So there was some debate about how to even define deficiency. So we are trying to conduct a study of vitamin D deficient persons, but yet we were struggling with even how do you best measure and define a vitamin D level in order to determine if someone's deficient.